The subject of electronic provider records comes up in lots of discussions about providers and the healthcare system. So let's take a quick look at some of the main things in this area. Historically, providers kept records from patient care on paper in what is commonly referred to as a patient chart. This might contain the provider's notes about medical conditions the patient had, diagnoses they formed, care they provided, follow-up care they planned, and lots of other things potentially. Often this would have been in text format, perhaps not always. Over time, it became clear that digitizing this information could be valuable if it were done well. The idea is that electronic records might be more easily maintained, maybe be more easily searchable, more easily used for communication from one provider to another, and so on. So electronic medical records, we might say EMRs, were born. The idea of an EMR is that it would be a digital version of the paper charts in a clinician's office or in a hospital, with the medical and treatment history of the patient in the practice or in the facility. Beyond being just useful for keeping track of the patient, though, EMRs could, at least in principle, also be helpful for other things, like tracking trends over time, or quickly looking at patients who need follow-up care or who are behind on needed care like vaccinations. You'll sometimes hear not only EMR, but another related term, an electronic health record, or an EHR. EHRs and EMRs are similar, and many people just use the terms synonymously. But if you get into it, you'll find some people who mean different things by the terms. Most properly, EHRs are conceptualized more broadly than EMRs and might be designed to capture a broader representation of a patient's health and healthcare. Where, finely defined, an EMR might be used within a particular practice or facility, an EHR might incorporate data from multiple practices into a more comprehensive record. Some people will make something out of the difference between a record aimed at helping with medical care and a record aimed at helping the patient stay healthy more generally, with a more expansive view of the information contained in the latter kind of record. Either way, as EMRs and EHRs become more widespread, there are lots of dimensions to keep your eye on. How effectively can these incorporate new approaches to utilize the data contained in them to help providers improve care and reduce costs and maintain quality? How effectively can we develop ways of having records maintained by different providers communicating with each other? For example, how can we make it easy for primary care physicians and specialists to communicate using EMRs or EHRs, or for labs and physicians, or for one hospital to another when a patient's transferred? Interoperability is a key issue these days, and also a challenge with many different systems used by different providers, some of which might communicate easily and others of which don't. How can patients be a meaningful player in the mix, getting access to their records from providers? And what about privacy? There are many different tools out there in the world, some more focused on doctors, some on organizations and facilities, some very broadly capable, some much more narrow, some cloud-based, other not. Depending on your questions and projects, this can be a very interesting and important space to keep track of. Oh, and one last piece of terminology here. Let me just mention what you might sometimes hear called a PHR, a personal health record. These would commonly refer to an electronic application for patients to record their own personal health information for their own use or maybe to share with their providers. Something related to, but different from, EHRs and EMRs.